Hello, this is Shilpa here. So let's start directly onto the management of acutes in our clinics. Now, when you are, when a patient comes with an acute episode, there are two types of expressions, as we understand. One is when there is a pure acute, and one when there is an acute exacerbation of chronic disease. Now, these are the two different types of presentations as we understand through the homeopathy concept. Now, the pure acute is basically anything which is related to an epidemic or anything which is related to the cause rather than the individual himself. So, there are quite a few different types of epidemics or acute presentations, acute causations, such as you could have accidents, injuries, any sort of trauma, surgery, any mental shock which is prolonged, or grief, loss, disappointment, any sort of physical shocks, electric shocks, burns, prolonged loss of sleep. So these are the acutes basically, which doesn't have to do with the individuality. Any person who could have been exposed to this sort of a factor would have a particular type of presentation which is very unique to the cause itself. It is basically uniformly, the characteristics of these episodes are uniformly common to all the individuals who have been exposed to this. And this is where we would look at basically what I call as therapeutics, right? So, what you would call as, another term for that would be a genus epidemicus, where you're looking at the common characteristics of the epidemic itself, of the expression of that particular, say infective agent, or that particular accident, or remedies for accidents, or remedies for trauma, or for surgical after a tooth extraction, say, or remedies for some mental shock, remedies for grief. So this is where you would open those stage 1 and 2 books and look for therapeutics to actually help your patients. So this is the role of therapeutics as I see in homeopathy, or the role of a genus epidemicus. Now let's go to the other type of acute, which is the acute exacerbation of a chronic. This is an acute which is what we call an individualistic or a sporadic type of an acute, which has come from the baseline, which has come from what we call in homeopathy as the fundamental cause, or what I would say, if I filter through the stages concept, it is the stage 3 and 4, which is being expressed. A chronic underlying disease is being expressed as an acute exacerbation. So say an acute exacerbation of asthma, that sort of episode would be a part of the chronic disease, right? Now in these cases you could have two different types of times the patient can come to you. The patient could come to you with an acute exacerbation right at the first visit, or the patient could come to you at a follow-up visit. Now the reason I'm differentiating these two visits is because the way you approach them would be a bit different. So say the first time your patient comes with an acute exacerbation, they come with a sinus infection, they come with bronchitis, or they come with some sort of a arthritis, and in acute pain. That is when you're looking at this, right? Now in this case, I would actually sit and take only an acute case, which is where you don't spend time looking at the deeper underlying baseline condition. Alright, you're still working at stage 3 or 4 depending on how you go, but you're not looking at a chronic baseline conditions, and I'll tell you the differences. So basically what you're looking at is these different types of so my acute case would consider 5 different things. One is the causation, what has been just in the recent a few days just before the episode, what has triggered this. It could be a physical cause, it could be a mental emotional cause. Most of the time a mental emotional cause which has triggered the problem it's wonderful to actually find that peculiar remedy. I'll look at the exact sensation, which is very clear and very peculiar. I'll look at the modalities, the aggravations, then the ameliorations. Then I'll look at the change in disposition. Now this is quite important. We're not looking at the mental disposition in general. A patient who is irritable in general is not we're looking at. We're looking at, has the mental state changed since the acute? Has he or she changed since this problem started in the last few days? That's what you're looking at here. And then we're looking at the change in disposition in the physicals. So the physical generals for me could be changes in appetite, in thirst, cravings, aversions, not the general cravings, but something has changed. Now, suddenly they've started craving for lemonade, or suddenly they're feeling really hot. So again, the temperature, the perspiration, the position of the body, something which makes them feel better or worse. Normally he's a very quiet person, but now he has to walk and is quite restless. Then changes to sensitivity to noise and light. So all these things are your physical generals. So when you're picking up this, it's like basically it's a very quick case, about 15-20 minutes, and that's it. You should be able to then my favorite repertory. I would use the Bodinghausen repertory here and just make a quick repertorization and produce the remedy. This is what I would do if the patient comes in an acute exacerbation in the first visit itself, and this in itself could be a remedy that really helps not just the acute, but in many cases it could be something which can be considered as a long-term remedy. We'll come to that, but this is for me the approach at that stage. Now in this case we are basically dealing with stage 2 and 3, right? You could have certain individual expressions coming up here, but this is how this whole case is going to work. Now let's look at the follow-up visit. Now say the person is already coming to you and you have actually found something which is what you would call a stage 3 and 4 remedy for that patient, right? And now he or she comes up for a follow-up. Now in this case you have to first ask whether this person has been doing well on that particular remedy or the patient has not been doing well on a remedy. So if that person is doing well on the remedy and now comes with an acute, you have to now find whether the acute is a part of the same picture or the picture has changed. The change in disposition of the mind, the change in disposition of the physical generals, have they changed or have they remained the same? If they have more or less remained the same, this is the time I would use the same remedy, because the same remedy would have an acute and a chronic state. Both of them are being expressed in that patient. If that patient is expressing quite a different picture in the acute, then you have to, and it is not a part of the remedy that he has been doing well, then this is the time I would definitely look for a different remedy. Most of the time this different remedy could be a complementary remedy. So if you open your repertories and you look at the back, there are remedies which follow well, or the remedies which complement the chronic of a remedy or an acute of a remedy. This is what we're looking at. So say for example, sometimes belladonna would be a great remedy when a chronic calcarea state would come up with a belladonna state, or a Rostock state, or a stramonium state, and so on. A silica would come into an acute pulsatilla state, or a natramute, which is a chronic sort of baseline remedy, and will come into an acute agnesia state, and so on and so forth. So this is where you will look at the complementary remedies table as well. And then let's come back to a person who's come for a follow-up visit but is not doing well. Now in this case, the issue is you just have to take a retake. because that particular remedy is not going to work. And so you are actually looking as if you're taking the retake of an acute case. And you don't have to, it's something like the first visit. It is basically you are just looking at the change in disposition and you're just sort of working out the acute picture. Most of the time, this is the best way to point you to the chronic remedy, which could also, that particular acute remedy could just be the one that you missed out, because now the picture is so clear, it was now quite easy for you to find the remedy. Or it could point you to a group of remedies within which you can start looking at. So many times, I had a recent case who came to me for the first time with an acute exacerbation, with a sinus infection, and the remedy which came up in that acute, in the first, when I took that acute case, was Rustox. So I gave her Rustox, the body ache, the fever, the sensitivity, the high sensitivity of the nose was the key sensation which pointed me towards Rustox. And apart from also the other factor of Rustox, better by motion and quite restless. But then she comes for an acute. After the acute is over, I call her for the chronic case taking, and the remedy which comes is Mangifera indica, which is from the Rustox family, but at a different level, at a different miasmatic level, and that's how it worked. So it pointed me to the chronic group of remedies, but quite close. So you see, this is how looking at the acute and the chronic, and sort of having that mind map in front of you, what to do and when, can be really a very having this approach in front of your eyes can actually help you with your patients. So hope that helps you, and hope that helps you make the best decisions for your patient. I would love to know what is your approach in acute, and if you have any new inputs, or if you have more questions on this, please don't hesitate to ask me, and I love to discuss this with you. Thank you very much, and hope you have a great week. Bye bye.